A lot of women have no idea that there is actually a treatment that can significantly reduce the risk for ovarian cancer, which is a horrible gynecologic cancer that often presents in advanced late stages because an effective screening modality does not exist. That treatment is actually surgical. It is removal of the fallopian tubes, and it was covered this past week in a couple different articles in JAMA. The procedure is called an opportunistic salpingectomy, and this is something that is done while another surgery is being done. Like the patient already needs to get XYZ pelvic surgery, perhaps a hysterectomy, or even another abdominal surgery. And while that surgery is taking place, they take the extra 15 minutes to also remove the fallopian tubes. And you may be wondering, if we're talking about decreasing the risk of cancer in the ovaries, why are we talking about removing the fallopian tubes? The answer is interesting. It's that studies have actually shown that most high-grade serous ovarian cancers, which are the most lethal, actually originate in the fallopian tubes. And there are studies show that when this procedure is done, there's an up to 80% decreased risk of ovarian cancer down the line. Importantly, these studies also show that this procedure does not lead to an increased risk of post-surgical complications. It adds about 15 minutes to the overall procedure. And because the ovaries are left intact, there is no disruption to hormonal function, and early menopause does not occur. ACOG, the American College of Obstetrics and Gynecology, has actually made a recommendation starting in 2019 to at least discuss this option with patients who are undergoing hysterectomy. And then just this month, the European Society of Gynecological Oncology went a step further, and they said that this should be considered in all women undergoing not only gynecological surgery, but even abdominal non-gynecological surgery. As someone who has a family history of ovarian cancer, I would be very intrigued by this procedure, and I would love to hear what you guys think in the comments.